On a daily basis, patients walk in and out of the hospital, some to deliver their babies or get emergency care. But not all have good stories to tell after their experience, owing to the shortage of manpower in the medical space. According to the statistics shared by the Lagos State Commissioner for Health, Professor Akin Abayomi, at the 2026 Ministerial Press Briefing, Nigeria has 40,000 doctors at a ratio of 1 doctor to 5,000 population, with an urgent need of 300,000 doctors, while Lagos requires an additional 40,000. In delivering better healthcare services, the Lagos State government is developing an ecosystem that can address biosecurity threats, enforce mandatory health insurance, and neutralize outbound medical tourism.
According to the WHO, we should have 1 doctor for 600 population. There's a shortfall of 30,000 doctors in Lagos and a larger number of shortfall for nurses. So this is a huge number. And let me just say, for the record, that human resources for health shortage is a global phenomenon. So for every health professional we have in Lagos, they're doing the job of 10. So we need to be patient with our healthcare professionals. They're working under very hard conditions. For us in health, we're able to deliver universal health care through a strategy called mandatory health insurance. And we don't want any Lagosians to leave Lagos to obtain any form of health care abroad.
Lagos, with a growing population of 30 million, can only boast of 34 public, secondary and tertiary health facilities, 325 primary healthcare centers with 3,500 registered private health facilities, while the patient and proprietary medicine vendors has 10,000 registered as part of efforts to improve primary healthcare services. In 2025, the federal government, through the Basic Healthcare Provision Fund, approved 32 billion naira for PHCs, primary healthcare centers, across the country, including Lagos.
Now, these funds have stringent criteria for you to access the funds, and they are not completely for consumables. You are expected to spend these funds on improving services at the primary healthcare levels.
We need to improve the working conditions of our healthcare professionals. We need to improve the living conditions of our professionals and facilitate the return of those that have already drained out of the country.
The state government is currently working towards establishing a University of Medicine to expand training of medical professionals.
His Excellency has given us the approval to establish the standalone University of Medicine and Health Sciences. We're going to decentralize the training of our healthcare professionals from the green circle through the yellow to the red to the blue, which means that we will have access to a very large number of patients.
The Lagos State government believes that the ongoing infrastructure modernization in the health sector will help address shortage of medical professionals and encourage residents to report any form of irregularity that threatens the safety of patients to the Health Facility Monitoring and Accreditation Agency to ensure healthcare standards across the state.